Okay, on to point 4, or lecturette part 4. And this is the cranial nerves, the dreaded cranial nerve exam. This is an exam that people find really difficult, really daunting to learn. And I don't think it's because it's difficult to do. To be perfectly honest, I think it's because it's taught poorly. It was taught poorly to me. It was taught in a way that kind of violates the principles of how human brains work. I've started teaching it a little bit differently. I used to teach it poorly, I'm ashamed to admit. But I thought, I'm not happy with this. So I've come up with a different way to teach it. This is a Mark Colbeck original. So if you like it, that's great. If you don't like it, you can totally blame me. So let's jump into the cranial nerve exam and talk about what they are. Again, the slides are available on paramedicine.com for your download if you want to see them. So this is how we typically teach the cranial nerves, and this is what I think is the wrong way to do it. Let's talk about what cranial nerves are first. So most nerves in our body go from our brain into the spinal cord, and then from the spinal cord, they go out to, our fingers or our toes or something like that. So if we want to find out if your brain is okay, we can touch your finger and say, can you feel me touching that? And in fact, we do that. But the problem with a test like touching your finger is that if it's not getting to the brain, it could be because there's a problem with the nerve that goes from the finger to the spine, or with the connection from the nerve that goes from the finger to the spine, or from the traveling up the spine to the brain. It could be something in between, and you don't know. There's no way to tell. If we had some nerves that came directly out of our brain, and we tested those, and they didn't work well, then that would really strongly suggest to us that the problem is either with the nerve or with the brain. But there's much less nerve going from a nerve that leaves directly from your brain than there is from your fingers or your toes to your brain. So it's the closest we can get to the brain to test your brain without cutting your brain open and sticking our fingers in. So the cranial nerves are really, really important when we're asking the question, is your brain okay? Now, here's how people normally test the cranial nerves. There are 12 specific nerves that come directly from the brain. You can see them in the picture there. And the normal way to teach them is, first we're going to teach you their names. And here they are, the 12 different names. So we're asking you to memorize a list of 12 bizarre words, which most people aren't very good at. The next thing we're going to say is, okay, let's take a look at that first nerve, the olfactory nerve. How do you remember it's the olfactory nerve? How do you remember the name of the optic nerve and the name of the ocular motor nerve? Well, a lot of people have come up with a lot of mnemonics, and most of these mnemonics are pretty lewd because historically the people who've been going through medical school in like the 30s, 40s, 50s, and 60s and stuff were young men who clearly had a lot of sex on their mind because that's all they seem to have mnemonics for. So the typical mnemonic for the cranial nerves is O, to touch and feel a girl's vagina and hymen. Now, I used to, don't blame me because I didn't make that up. I'm reporting a historical fact. I just read the news, folks. I used to teach in the Middle East, and I thought, I cannot teach that mnemonic in the Middle East. So I came up with another one. There's other ones as well on Old Olympus something or other. I've never learned that one. But there's a bunch. If you look up mnemonic for cranial nerves, there's a whole bunch. But the one I came up with and I taught in the Middle East, and the guys and gals liked it, was O, to touch and feel a girl's veil and hair, because that was sufficiently lewd to be exciting and memorable, but it wouldn't get me kicked out of the country. So that's what I came up with. But whatever you want to come up with is your own. If you want to learn it that way by the brute memorization, which, as I'm saying, I don't recommend. So first, typically, people just, bulk memorize the names. They smash that into their head. And then we have to know, well, that particular nerve, is it a sensory nerve for feeling, or is it a motor nerve for, movement? And some are sensory and some are motory and some are both. So the first mnemonic I came up with, here we've got listed in the next chart, sensory, motor, both motor. How are you going to remember that? Well, the one I learned was, some say marry money, but my brother says big boobs matter more. And as a liberated male in this age, I think that big brains matter more. So that's how I choose to remember it. You can choose to remember it however you like. if you choose to memorize it this way. Or if you're graphic, you can maybe take a look at where they come out of the brain stem and the brain and try to remember it that way. None of that ever worked for me. So I'm going to teach it to you in the Mark Colbeck way. And this is the Mark Colbeck way. I want you guys to remember how to do the assessment first. Don't worry about the names. Don't worry about sensory. Don't worry about motor. I'm going to show you how to test somebody's head and make sure their head is working properly. And I'll tell you what normal is. And if something is abnormal, then what I'm going to recommend, at least when you're starting, is that you say, oh, that was an abnormal one. Let me look up on the chart what that means. And then eventually with time, as you do more and more neuro exams, or if you're practicing for your paramedic degree or your EMT test or NREMTP or ACP or whatever you're doing, PCP in Canada, then you can learn what it means for. Socrates actually once said that nothing can be in the mind of a man or a woman until it's in their hands first. That's sort of the philosophy of Montessori teaching. So I agree with that. Let's teach you how to do something tactile and practical first, and then we'll figure out what it means. Then we can abstract, but let's get the concrete first. So here's the concrete. I want you to remember 7, a W, a snap, and down the holes. Say that again. Say it out loud with me. A 7, a W, a snap, and down the hole. Here's what that means. We're going to test the head, the cranial nerves that present in the head, externally onto the face and the head, in this order. So the first thing is a 7. And when you think of the 7, what I want you to do is think about starting at your nose and going up and then testing your eye. So it's a recall to tell you to test their nose and test their eyes. And if you want to think about how that comes across, think about it as a 7. The next thing I want you to test is the W. And the W is down the sides of the face and then up the middle of the face. So 7, W, and then we're going to do a snap. And the snap is snapping your fingers or just rubbing your fingers beside the patient's ear. And then down the hole, which means we're going to go down the mouth, down to the shoulders, and test in that pattern. Okay? A 7, a W, snap, down the hole. Remember that first. That's the first thing to commit to memory. Now let's go into a bit more detail. So the 7, we're starting with the nose. And if you can remember, that's the olfactory nerve. That's terrific. It's a sensory nerve. It's not a motor nerve because we don't motor smell in any way. It's just a sensory nerve. So how can we test if somebody's smelling is okay? And normally we don't test this very diligently in the field or very, in a focused way. But you can ask people, how's your smelling been lately? Have you been smelling things normally, or have you noticed that your sense of smell is off? And you got to be careful about this because somebody might be asking you, somebody might think that you're asking them if they have like body odor. Have you been smelling bad lately? So just be careful how you phrase this. I usually say, how's your sense of smell? Have you been able to smell things normally, or have odors seemed off to you? And if they say, yeah, I haven't noticed anything, that's probably good enough. That's normal. If you really want to test, we actually have something on the ambulance that smells a little bit, and those are the alcohol swabs. So you can open up the alcohol swab and just wave it under your nose and say, can you smell that? I've read in books that some neurologists will carry around coffee beans and cinnamon and stuff. We don't do that. We don't care that much. If somebody's sense of smell is gone, then that kind of, after a car accident, that kind of makes me think, maybe there's something wrong with their brain. But if that's the only thing that's wrong, I'm not terribly fussed. So the olfactory nerve is, not terribly important to us. But we ask, have you been able to smell things normally? Here, I'm going to open up this alcohol swab. Can you smell that? Does it smell like alcohol hand wipes and stuff to you? You can also use if you've got the hand wash gel, just wash your hands and say, can you smell that? Does that smell normal? So that's testing the olfactory nerve. And normal is, yeah, I've been smelling okay. Yeah, I can smell that. It smells like alcohol swabs. Great. Done. Next, we're going to go to the eye. And in the eye, we're actually covering 4 nerves. And we're covering them slightly out of order because we don't do the 5th one here. So we're doing the 2nd, the 3rd, and the 4th, and the 6th. And you're probably thinking, Oh man, this is going to be a really complicated eye exam. Well, have I got great news for you because you already know how to do this test. So we ask them, how's your vision been lately? Have you been seeing normally? Can you see clearly now? And if they say yes, that's normal. Then we take a look when we walk in and we see, are they tracking well? Do they have a midline conjugate gaze? Are they pearl? Are they able to accommodate? And do they have normal ocular motor with the H? So normal for all of those is that they watch you, their pupils are midline, they're pearl when you shine lights in there, they accommodate, close and cross as you get your fingers there, and when you do the H, it's all normal. If they do that, boom, you've just checked out another 4 cranial nerves. That's 5 done already. We're almost halfway there because there's only 12. So learn this pattern of testing, and then we can worry about what it means later. Now, this is a deep dive. And this slide is here just for the nerds, just for the geeks who love this sort of thing. If you've memorized this out in the field and you know all the other stuff, if you've memorized this, then you've got some pretty good neurological assessment kung fu going. But you don't really have to know this. Ideally, you can just, or at a minimum, you can put this into your little notebook and look it up later if their eyes don't move normally with the H test. But we're testing several nerves. We're actually testing 3 nerves when we do the H test, and this shows which ones they are. So cranial nerve 3 is the big one. And if we just look at one eye, if we go lateral with the eye and up and down, that's cranial nerve 3. And if we go medial with the eye, up into the middle, that's cranial nerve 3. So again, with this one, lateral, up and down is cranial nerve 3. Up and middle in the medial line is cranial nerve 3. If you want to memorize that, it's kind of cool and interesting. If you really don't want to memorize it, just keep it in a chart in your pocket. In the middle, going down, is cranial nerve 4, and looking laterally with each eye in the middle is cranial nerve 6. Interesting? Not essential, okay? So we've done the smell, we've done the eye test, which you've already known. Now we're going to test 2 more, and we're over halfway. The trigeminal nerve and the facial nerve. Really easy to do. This is our W. So really we're going down the side of the face and then up the middle of the face. So what do we ask? Have you noticed any weakness in your face muscles lately? Have your eyelids been drooping? Has your face been kind of drooping? Has anyone told you that your face looks a little slack and droopy? That's a question I would normally ask. If I walk in and someone's kind of looking like this, I would say to the family or a bystander, their face looks a little flat, a little droopy. Does that look normal to you? And if they go, no, that's brand new, I was kind of wondering about that, then I think, okay, abnormal. So normal is, you ask, have you noticed any weakness in your face recently, in your eyelids or in your ability to smile? And they go, no. You think, good, normal, green light. Let's keep on asking. Now we're going to touch their face at 3 points. The first point, illustrate this really well on me because I don't have any hair to get in the way. We go up just sort of on the side of the head and say, can you feel me touching here? We don't have to do pinpoint or hot or cold or anything fancy. Just take your hands, probably with gloves on is better, and touch just up here at the temples, sort of above the temples here, and say, can you feel me touching there? And if they say yes, that's normal. Next, we're going to go the zygoma here, and just go below the zygoma a little bit and say, can you feel me touching here? And if they say yes, that's normal. And you might ask them to grin a little bit and tighten their jaw, and you'll feel the muscles. If you feel along the zygoma and then come down sort of in the middle of the back of the cheeks here and tighten up your teeth, you'll feel those muscles pop out. That's normal. And then go down to the bottom of the chin and say, can you feel me touching here? So can you feel me touching here? Can you feel me touching here? Grit your teeth together like this, and you can feel it, and then can you feel me touching here? If they say yes, we checked out with the trigeminal nerve. Now we're going to go up the middle and do the facial nerve. So there's 3 points as well. There's 3 points down the side, trigeminal nerve. It's got 3 branches. And in the facial nerve, we're going to do 3 tests as we go up. So the first test, let me do this. The first test is we're going to ask them to smile. And usually we have to demonstrate this for the patient. I say, can you give me a really big smile? Big teeth together, really big smile. And if you want, you can ask them to smile and grit their teeth together while you're feeling in the middle, and then you've actually started into the facial nerve as well. So big smile, and that's normal. It's a symmetrical smile. If they go or something weird like that, that's abnormal. If it looks like a normal smile, it's normal. From the mouth and the smile, we're going to go to the second point, which is the eyes. And what I say to the patient is, I'm going to ask you to close your eyes, and I'm just going to lightly put my finger on your eyelids, and I'd like you to try and open up your eyes like that. And it should be difficult for them to open up their eyes, but you should feel them pushing against you. No one's going to actually be able to lift your fingers up with their eyelids. They're just not that strong. But you should feel them moving against your eyes. There should be some muscular strength. And then the last thing we're going to test is on the forehead, and we're going to ask the patient to wrinkle up their forehead and take a look at the wrinkle. I got great wrinkles on my forehead here. Take a look at the wrinkles on the forehead, and they should be roughly symmetrical. Down this midline, they should look the same, see, on either side. So that is trigeminal and facial nerves. So that's our W. So we've done our 7, smell, eyes. We've done our W, going down the side for the trigeminal, and then smile, eyelids, and wrinkles for the facial nerve. Now, really quickly, the auditory. We asked the question first, how's your hearing been lately? Have you noticed any problems with your hearing? Have you noticed that you can't hear people speaking to you very well? Have you noticed any ringing in your ears or anything like that? The other question we're going to ask, which might not be initially intuitively obvious, is we're going to ask about their balance. Because remember, there's the ears for hearing, and then there's the inner ears for balance. So we're going to ask about the inner ear for balance. And we're going to ask, have you noticed any vertigo? Have you noticed the room spinning? Has it felt like you haven't been able to get your balance lately? And those are the questions we're going to ask. And then we're going to do our little rubbing, just sort of rub your finger and your thumb together beside their ear. You might have to snap a little bit if you're in the back of the rumbling ambulance. And just say, can you hear equally on both sides when I do this? And if they say, haven't had any troubles with my hearing, I haven't been feeling dizzy or feeling room spins, and yes, I can hear you equally on both sides, then they've just passed the auditory nerve exam. Their hearing and their inner ear is okay. So now we're just going to go down the hole. See how easy this is? It's really, you just practice this on each other and it's fine. So the first thing we're going to test, these are slightly out of order, okay? And you'll notice that as I'm doing this, we've been skipping numbers around a little bit, but I'm putting it into order of how we assess. So when we go down the hole, we're going from the outside down to the deepest at the shoulders. So first thing we're going to ask is, has your voice changed at all? Have you noticed that your voice is more hoarse? Sometimes you'll talk to people and they're talking to you like, I'm Batman. And you think, wow, that's a deep, rumbly voice. And you ask people beside, is that what their voice is normally like? Or you can ask the patient, is your voice normally that raspy and deep? And if they go, no, it just started. Like, well, okay. So that's maybe a problem with hypoglossal there. We're worried about it. But if that's how they normally speak, then it's normal. Have they had any difficulty with their speaking? Have they had any difficulty swallowing? Another way we can test sort of the speech to make sure their vocals or vocal cords are working properly is to ask them to cough. And most people, when they cough, will cough like, but if they cough like, that's another indication that they probably got some problems with their cranial nerves. So, going from the outside in, first thing we're going to ask them to do is stick out their tongue. And again, I demonstrate this for the patient. Say, can you stick out your tongue at me? Just like that. Stick out your tongue. And normal is what I just did. You stick out your tongue, it goes in the midline, there's no deviation, there's no quavering, it's not weak. Abnormal would be like, something like that, and they can't. Now, if they can't stick out their tongue, ask them if that's normal for them. And if that's normal, it doesn't indicate a change. But if you say, can you stick out your tongue for me? Let me see you stick out your tongue. And they go, when you say, can you normally stick out your tongue? They go, yeah. Okay, then that's abnormal. So maybe something's wrong with their brain. Next thing we're going to do is we're going to ask them to open up the mouth and say, ah. And you're going to take a flashlight and you're going to look in their mouth. And at the back of the mouth, hanging from the top, is the uvula. And the uvula is the little punching bag thing. And when people open up the mouth and say, what you'll see is the uvula will go and rise up. That's normal. If it doesn't rise up properly, symmetrically in the midline, that's abnormal. Next thing we're going to do is ask them to try and swallow. And again, I say to the patient, can you swallow for me? Just try to swallow a bit of spit. And if they can, that's normal. And then you say, can you just cough gently? Again, I demonstrate. Can you cough for me? With a bit of vocalization in the cough. And normal is, abnormal is, now, maybe if they're a smoker, if they got emphysema or something like that, they'll have that deep sort of heavy throaty cough. How do we tell? We just ask them, is that how your voice normally sounds when you cough? And if they say no, then maybe something's wrong with their brain. And then the last thing we're going to ask them to do is you stand in front of them and you say, I'd like to put my hands on your shoulders and I'd like you to shrug up against my shoulders, push my hands up. And they should have equal strength. They should be able to lift your hands up. And if they can, then that's fine. Then that is your that's accessory muscle or accessory cranial nerve working properly. And again, see, if you do this, if you run into the situation where you're doing a cranial nerve exam and you say, okay, can you push your hands up against or push your shoulders up against my hands? And they kind of go, oh, and they can't, or it's unilateral. Then you can go, which nerve is that again? Can't remember. I'll look it up. So look it up in the ambulance on your way to the hospital. But eventually, it feels daunting at first as we ask you to try and memorize, like 24 different things, the names of the nerves and the motor or sensory. It feels daunting that you'll ever be able to memorize all that. But if you memorize this physical structure first, then you can start to build the names onto them. And then you can start to think about whether they're sensory, motor, or both. But first, learn the actual assessment, okay? So this chart, I can't read, is the one that I would like you to print up and put in your pocket or put on your smartphone or whatever you want to do. Like I said, you can get these graphics from paramedicine.com, download the PowerPoint and copy and paste. You'll notice if you go down where it says CN, that stands for cranial nerves, then these are out of order. They're not 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. It's 1, 2, 3, 4, 6, 5, 7, 8, 12, 10, 9, 11. Why are they out of order? Because this is the order that we physically test them in. So this is the chart that you hold on to because it's the one that will tell you if something's wrong or not. Okay? So you've got that chart. Just honestly, when I do this with the students, we have a 3-hour prac lab in some of our units. And within about, 10 minutes, they've learned how to do the 7W snap down the holes. It's not hard to do. And then they just naturally have this curiosity of, okay, so what do those mean? And then they start looking at this chart. And within about an hour of practicing with each other, you can get your cranial nerve exam down. It's really easy. You don't need any equipment other than a flashlight. You can just go to a friend's house and sit and practice the cranial nerve exam until you've got it down. Easy peasy, heart goes squeezy, and you'll be really comfortable with the cranial nerve exam. Okay? That's it. It used to be such a frightening, intimidating thing, but learn the physical examination and then start to remember what the physical examination is testing, and you'll know your cranial nerves. If you got any questions, leave them in the comments. I keep looking at these, and when I see them, I get a little notification that someone's left a comment. I'm happy to come back and take a look and answer your questions if I can. Enjoy this. This has been really popular with the students that I've taught. I've taught it at conferences and stuff, and people go, that's so easy. And it actually really is. And it's really gratifying as a teacher to get that feedback. So I hope you enjoy it. If you do really like it, leave me a comment just saying, hey, that really worked for me, because this is still kind of new and a new way for me to teach it. Enjoy.